Dr. Todd Van Yee from the Center for Aesthetics and Plastic Surgery in Neenah is here today to talk a little bit about a mommy makeover. Everyone's heard of it, but what exactly is it? And Mom, maybe you've been thinking about having something done, and Doctor is here to talk about all different things that you can do, from a lot of stuff to just a little stuff. Good to see you, Doctor.
Good morning, Amy. Good to see you again, too.
Well, okay, let's talk first a little bit about surgical things, some surgical things that that you guys do, that, you know, little things that can make a big difference.
Okay. Well, before I say that, I just want to say thank you to all the mothers out there. And you guys do a wonderful job. You have a very, very difficult job. I think a lot more difficult than we have most of the time. And, you know, that's from, you know, emotional, physical effort that you put into raising the kids. So
you're sweet.
Early
Doctor.
Happy Mother's Day to you, and thank you to all the mothers out there.
Thank you.
When we say mommy makeover, which has kind of become a little phrase that has been used around the area, typically we're thinking about the stomach and breast surgery. Okay. Most of the women that I see are not looking to be glamorous. Right. They just want to be comfortable putting the bathing suit on and taking the kids to the pool.
Absolutely.
So we're not ever trying to push an extreme. In some sense, the mommy makeover, certainly as far as abdominoplasty or tummy tuck surgery and breast surgery, is just to restore something like the figure you used to have.
Got it.
Before the physical changes that take place with pregnancy, with nursing your children. Okay, that's what the classic mommy makeover would be.
Okay, got it.
There are a lot of other things that mothers can do. I had a woman come in, just a couple of weeks ago, really, for surgery, and her concern was she was just looking tired. And her kids said, "Mom, why are you always crabby?" And her response was, "I'm not crabby." But being a mother can be fatiguing, and you all worry a lot too about the children. And that, I think, can show on somebody's face as well too. So there's some things that we can do non-surgically as well to just help to refresh, help a woman, help a mother to feel comfortable with who she is. Not necessarily glamorous, but comfortable.
We've got a little screen up here. So some of the non-surgical things that you can do that really make a big difference, aren't a big deal. You're in and out. You know, it's not like it's a long stay. It's not expensive. Of course, we've all heard of Botox. You know,
Botox and some of the fillers like Juvederm are very, very quick, fairly easy things to do. I would just caution people to make sure you go to somebody that has had a lot of experience doing this. It's because it's easy. There are a lot of physicians and non-physicians that are doing this, and you've got to be careful with the results. One of the other things I think has just been fantastic, and quite honestly most of the women in my office have had it done, is the permanent makeup application. You know, if you're on the go and you're hustling and bustling, you've got kids like you dropped off at school this morning, often you might not have time to put on makeup. So permanent makeup application can be done very, very tastefully, and then you just don't have to worry about that step in the whole process of getting ready. There are a variety of other things as well too. One of the neatest things that's becoming more and more popular now is laser liposuction. And this can be done very, very quickly, quite honestly. No general anesthesia, no sedation. Mothers, guys too, but certainly mothers, often have a very problematic area. You've had your children, you've gained your weight, you've lost your weight, you're back at the gym now, you're working out, and you know what? I just can't get rid of this or that. And it doesn't need a major operation, but sometimes coming in, local anesthesia, we can be talking while we do the laser surgery to thin out an area, to recontour an area. When I've done it on some of my office staff, they were back to work the next day. Really?
Wow. We've got a picture that we want to show you, and this is a woman who came in, and what did she have done?
Well, this person had both a combination of a tummy tuck as well as a breast augmentation or breast lift. Very, very typical abdomen on the left-hand side. And it's not just the skin that gets stretched out when you're pregnant. It's the muscle layer underneath the skin. So liposuction alone sometimes doesn't fix it. With a tummy tuck, not only are we taking out the extra skin and hopefully removing many stretch marks and getting a much flatter abdomen, but we're also repairing the muscle layer, and you can see that very clearly in that picture.
Wow.
That the muscle is much flatter as well too.
Big difference. And the you know, back to work time or back to being a mom time, is the recovery is way quicker than it used to be.
Very much so. These procedures are all done as outpatients. Sometimes, you know, overnight is recovery enough, as I said, with the liposuction, the laser liposuction. Sometimes a few days off, or at most a week, and then you're back to pretty much your normal activities.
Well, something to think about for sure. I think that we all think about those things and appreciate it. You know, mom takes care of everybody else, but sometimes doesn't take care of herself.
Sometimes mom needs to take care of mom as well, too.
Absolutely.